The Malawi hospital reform campaign started way back in Kamusu's time. Governments have been introducing the reforms, but so far no government has managed to finish this assignment. In 2015, the Malawi government revived the hospital reform initiative, and since then, the Malawi German Health Programme, MGHP, has been supporting the renewed hospital reform efforts. In April 2019, the reform process started in full course, with the Malawi German Health Programme working with the MOH's Department for Planning and Policy Development, Kamuzu Central Hospital, and Queen Elizabeth Central Hospital. After successful hospital reform, the status of central hospitals will improve planning, increase ownership and accountability at hospital management level, and this will improve the service delivery for the population served. 2 years have passed. What exactly have we achieved in the past 24 months? But first, a look at the hospital reform process through the donor's eyes.
The hospital reforms project that we have been implementing together with our partner, the GFA, in the last years, I think goes back to the reform program laid out for the health sector in 2015, in which the government clearly said that one of the key reforms in the sector to improve care for the patients was to make the central hospitals autonomous, give them more management authority over the issues, over how they want to provide care, on what areas they want to develop in their hospitals further. And that was then taken to the German government, and the German government was very happy to say, yes, we will engage in this process to help you achieve those objectives. And the way that this was meant to be going was to say we will turn the central hospitals into trusts with their own board of trustees to oversee the operations of the hospitals and ensure that the interests of the patients would be safeguarded in the best possible way. And this process has taken us to where we are now. We're there where the hospital trustees are in play, are developed, where we are just waiting now for the boards to be appointed and take up their function and oversee the management. And in this process, we have gone through, I think, a number of steps that has made the hospitals much better prepared now than they were when we started. At the outset, we went into the hospitals with the colleagues from the ministry and did an assessment of where the biggest capacity gaps are. Based on this, capacity development plans were laid out, and the technical working group hospital reforms gave itself a work plan to focus on the different areas. And then from there we picked the areas to engage in with the hospital reforms project. And this looked at three different layers. It looked at the people in the hospital, their skills and their knowledge, the management capacities. It looked at processes of the organization, and it also looked at the legal framework that was necessary and where further steps needed to be taken to strengthen these things. And the hospital reforms project addresses all of these areas.
What is the donor's view of the past 2 years?
Whenever you are running a project, then there are things that you think could have gone better. But I'm reasonably happy with where we are, because we have also been operating in a very difficult environment, I would say. In the last year and a half, the world has gone through a global pandemic. In Malawi, we have had 2 waves of COVID-19. We're just entering probably the third wave, and we have to see our achievements also in this context. If we think what sector has been most affected by this pandemic, then we certainly will say, well, the health sector. And I think a tremendous amount of additional work has come down on the hospitals during this time. So that has had obvious consequences also for the achievements. And I think the amount of time hospital managers had to think about the future, about the structures and processes, and maybe also for their own skills development, wasn't as large as it could have been under normal times, when things are going more smoothly and steps can be taken more measurably. That said, we have always felt that there's a strong degree of enthusiasm with the hospital managers for this process. And they have allocated time with their management teams, with their staff, to talk about what needs to change, about ways how to address things, and also to discuss with coaches of how they can then do these things in their hospitals. So I feel that we have made good progress in the last couple of years on many issues, and that we are definitely in a much stronger position that when the boards are appointed, the hospitals will function in a very good way.
So far, a lot has been done already. Steps and decisions have been made. Trust deeds have been developed. Human resource management based on performance has been prepared. Management has been trained on public finance management, and outsourcing of non-core services and strategic plans for central hospitals have been developed.
So we have something like a trust deed, which is more like a constitution for running this institution independently. Mm-hmm. We've also drafted some what is called a business charter, and in preparing for this transition, the HRP project has supported the reorganization of the organization structure. So some new executive position have been created with the help of the functional review, which is championed by the Department of HRD. The fact that these are new positions, so we've also supported in the development of job descriptions, and also come up with performance contracts for these new positions. You may also want to know that because being semi-autonomous means the staff who are currently working would now change their employers, and therefore this necessitated also to come up with new human resources procedures. So we've drafted the procedure manual that the decent hospitals are meant to implement or adapt. We've also developed the public finance management procedures. Also in readiness that this semi-autonomous hospital should apply. In terms of strategic and operational management, the project has also helped the two central hospitals, Kamuzu and Queens, to develop the strategic plan for 2020 to 2024 in line with the HSSP 2. So those are the major breakthroughs. There have been some coaching and mentorship programs, but those are minor, but those are the one I've mentioned earlier, our major milestones.
In Malawi, public hospitals largely provide free health services, and the country invests less than recommended in the health sector. Can hospitals providing free health care really reform and serve the public, achieving the hospital reform process objectives?
My expectation is that we will have a better working hospital that is able to provide better care for their patients, because decisions can be taken closer to where they are needed, where somebody takes the decision who feels the pain of not having a decision taken and has all the information necessary for making a good decision. The further away from the pain the decision is taken, the less urgent it seems. the less information is there to really make the best possible decision. So I feel by allowing hospital managers to make more decisions in the operations of the organization, then we will see an improvement in care, and that's what I'm hoping for.
We will be interviewing different experts at the Ministry of Health